Hi everyone. For discussion 8, it's giving us the scenario if we were asked to do something unethical in the professional setting. And this is something I've actually kind of experienced firsthand a little bit. I've mentioned before in other discussion posts that I've worked as a certified nurse aide at long-term healthcare facilities and acute healthcare facilities, like at hospitals and stuff. And oftentimes things aren't textbook perfect. A lot of the times you're finding yourself in very unfortunate situations, not only that the patient experiences, but even the healthcare providers too. I most often experience this scenario kind of in the long-term healthcare facility at the nursing home. um, Not many of you might be aware, or many of you might not be aware, but majority of nursing homes all across the state and just healthcare settings in general experience a very all-time shortage of CNAs and nurses. It's constant. They're always needing hires. CNAs have one of the highest turnover rates in terms of jobs, because and nurses too, and it's just because it's very physically and mentally demanding. What you do, what you're told to help with, what you're told to deal with in order to help out with the patient. It can be a lot, and on top of that, it being short staffed, you're having to put a lot more on your plate. Oftentimes you see patient ratios of like one CNA, and speaking in terms of long term setting, like in a nursing home, ratios of like one CNA to like 15 to 18 patients. And at a nursing home I worked at, I knew people that were unfortunate to get like one whole hall that had like 20 people. And a lot of the things that you have to do in that scenario, because you don't have that much help, you can't provide the best healthcare that you can, because you're just so short staffed that, at least in my experience, it's very unethical for people to not be able to take care of like old folks like they should. Because in a nursing home and in an assisted healthcare facility, CNAs and nurses are expected to get their patients out of bed, dress them, change them, shower them, get them their 3 meals, and put them back in bed when they want to, get them up. And a lot of times people need help. If you're in a long-term healthcare facility like that, you're not exactly in a condition where it's going to be easy for you. You need those CNAs to either help patients that have diabetes, that experience amputees, or could be just not strong enough to use their own limbs anymore, or they're severely obese and they just need that much help. So you need two CNAs to operate assisted devices, ideally, but oftentimes you're having to just be there by yourself in a Hoyer while you're trying to pick up this 300 pound woman up off the bed because she can't move, and you're being tasked to just help get them ready, change them, and supposed to be doing all that in under 15 minutes. And it might seem simple checklist on textbook, but while you're in there in that setting, it's a very high stressed environment that oftentimes is very it's not the best situation. It's unethical. It just what you're forced to do in scenario. And I experienced this. I've even been, I guess, a part of it just because of the lack of patience, where I've had to tell patients, I can't get you out of bed today just because I don't have the help, because there's no one here at the healthcare facility to help me. And already speaking through my own experiences, when I was working in that type of setting through COVID, I saw a lot of things where you're forcing people to be in isolation. It's kind of a big thing for I mean, it was a big thing for everyone, but not to, because I've already talked enough on that. Regarding this question, after this long-winded discussion, it's not often as black and white as it seems. I mean, you want to be able to say that you're gonna say no, to be doing something unethical. Obviously, if you feel like whatever you're doing is putting the patient at risk, don't do it. That's obvious, but a lot of the times you're being put in these stressful situations where oftentimes you're not doing everything like by the book. You have to be able to think on your feet and do things, I guess, sometimes unethically. You don't want that situation, but given the situation that some people are left in, it's quite hard to try and do things like by the book. You have to be able to think outside the box, while trying to put the patient's needs ahead of your own, and sometimes, that could lead to, injuries of yourself while trying to like help. And then, I mean, all of that's why ethics are there, so that way that stuff doesn't happen, but it still does. That's why you see such a high turnover rate for CNAs and nurses. And it hits home to me because that's what I do, working for patient care experience. I've done that for going on 3.5 years, 3 years. Yeah, very long response, but hopefully that provides some context. Thank you for listening.